Okay, so the lockdown that we appear to be going into in Ontario is unnecessary, it's destructive, and it ultimately leads us nowhere. And the reason I say that, first of all, it's unnecessary because the important thing about COVID is not the disease itself, it's the serious complications of the disease, the deaths in particular, and the serious illnesses. And there's been quite a remarkable change in the last 3 or 4 months in the profile of COVID, in that the death rates have come way down. It's no longer the frail elderly who are getting infected. It's young people, and young people, thank goodness, hardly ever die from this. And so the magnitude, the number we should be looking at in Ontario is not the case count, it's the death count. And the death count lags behind the case count by a couple of weeks, but it's very low. I think there were about 4 deaths in a province of 14.5 million people, a province where, by the way, 300 people die every day. I mean, they say the definition of insanity is you keep doing the same thing and expect a different result. Well, we locked down for 4 months and we got some warm weather and we opened up. And guess what? In September, as was widely predicted by me and many other people, it came roaring back. The lockdown that we suffered through in the spring really accomplished nothing. I think when we locked down in the beginning of March, middle of March, people thought it was going to be for a couple of weeks till we got our healthcare system in order. Well, we did. There was no strain on our healthcare system. In fact, there's been no overrunning of healthcare systems anywhere in the world, with the possible exception of Northern Italy. If we lock down now, when do we come out of lockdown? Do we wait till next summer when we have no society left? Doesn't make any sense. We have to realize that all lockdown does is to change the dates. It doesn't fundamentally change anything about this outbreak. It's a strategy that leads nowhere. Well, the whole phenomenon with masks has been absolutely remarkable. The sentiment that I expressed, that was something I wrote at the beginning of March. And I would say that probably 99% of public health and infection control experts, certainly in the Western world, agreed with me at the time. I was simply expressing a mainstream idea that masks were not going to be useful. And that's an ideology that's based on a fairly substantial body of evidence, looking primarily at influenza, in which the benefits of medical masks in some circumstances, like in healthcare and in dealing with household contacts, there are some benefits. But beyond that, the sort of public general use of masks, particularly of non-medical masks, was something that was there was really no evidence to support, and was generally, I think, dismissed by me and by most other public health experts. And then this remarkable thing happened in April and May. Suddenly, the world turned 180 degrees. Now, that would be understandable if there was some major new robust piece of scientific information that came forward. But there was not. There were a few very low quality studies related to masks and COVID. There's what we call this ecological correlation, where people said, well, look at countries in East Asia where everybody wears masks and they don't have a lot of disease, which is true. But of course, there are also all kinds of countries, for example, in Africa, where people don't wear masks and they have even less disease. So was it the masks? I don't know. That's very, very weak evidence. And anybody who's trained in epidemiology knows that's very weak evidence. And yet, suddenly, everybody flipped 180 degrees, and masks became not just something that was useful, but sort of the fundamental building block for controlling COVID. Well, okay, so we've got mandatory masks in Ontario, and when you go out into public places, you'll see about 99% of people wearing them. And what's going on? Disease rates are shooting through the roof. It's working really well, isn't it?